Right, let's begin with the class. So, welcome to first of all, let me welcome you to Let's Crack NEET PG. Right, that's the YouTube channel of Unacademy, their NEET PG division. So, I would like to welcome you to that. This video, it's not a live video; it's going to be a premiered video. So, this video has two parts to it. The first part of the video is the subscription pitch, and after that, you will move on to whatever the content of that video is, whatever I'm going to do. Right? So if you want to skip ahead, you can skip through the subscription pitch, right? Scroll through the taskbar, and you can reach to the end of the subscription pitch where I will be telling you everything about the Unacademy subscription, the Unacademy Plus, and the Unacademy Iconic subscription. And you can skip ahead of that, and you can move ahead to the content. So again, let me welcome you to Let's Crack NEET PG, the YouTube channel. So for the YouTube channel here, you have the top educators, right? So we are the top educators here who are going to be teaching you on Unacademy, and we'll be giving you quality content. And I assure you that this video will be a great learning experience for you all. You might have watched our live videos. Now, during this time, we are uploading these premiered videos, right? And they're recorded sessions for you, which are in a very concise and structured manner, so that whatever we give to you, you can retain it efficiently, right? So learning should never stop. So first of all, if you're wondering who am I, and if you've not watched any of my live sessions or recorded sessions, so my name is Chetanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences, that is AIMS, New Delhi, right? Which might be a dream destination for you. And my All India rank was 4 in the AIMS UG entrance examination, and my All India rank was 5 in the JIPMER entrance examination. As you all know, all of these examinations have been merged under a single name, the NEET examination, the results for which were declared recently. So now it's all as the NEET examination. For the NEET PG, this is the NEET UG examination. And you all know that for NEET PG right now, the exam is the NEET PG examination. Then you have separate exams for AIMS, PGI, and JIPMER. But this year, Central Institutes, they're combining AIMS, PGI, JIPMER, and NIMHANS under a single exam called as the INICET, right? And it is proposed that both of these exams will be replaced by the next exam. The next exam pattern has uh, a lot of clinical weightage, and only around 10% of the weightage goes to pre and paraclinical subjects. So that is about this. And right. So before I move on to the content, I want to tell you about Unacademy. It is my job to tell you about the Unacademy learning app, the Unacademy platform as such, and the Unacademy subscriptions, which are the most useful things for you, right? So first of all, do one thing. No matter what, don't think about any purchases. Don't think about any subscriptions. Just go ahead and download this free Unacademy learning app. Go ahead and install it, and I'll tell you how this will be useful to you, right? This already has over 10 million plus downloads, so don't worry about anything. Just go ahead and install the app. And as you can see, it is the number 3 top free app right now, right? So a lot of people are already using Unacademy to learn. Top educators, including me, are teaching you here, right? You can see that there are a decent number of watch minutes, there are a decent number of followers that are already connected with all of these people. You can see here around at least 12,000 people are connected right now with a few educators, right? And it's a constantly growing thing, all right? So we educators, we are creating structured courses for you on Unacademy Plus, right? So all of these courses, they are plus courses, and as you can see, these are locked, which means that you will be able to access them if you have a plus subscription, right? So you will ask me if your app क्यों download करवा दिया, है ना? So all of these are plus courses. So educators, so for example, if you want to have a complete course on genetic and metabolic errors in pediatrics, right? So you can see that there is a course here which has 6 lessons, pediatrics course here that you can be learning from, right? Similarly, if you want a foundation course, right, which are batch courses, you can see courses such as these. These are batch courses where multiple educators are teaching together for a particular subject, right? Now, the reason I told you to download the app was these special classes. So as you can see here, that educators keep taking free special classes for NEET PG on Unacademy, right? These classes are completely free of cost, and you can all you need is either you can watch them on your laptop, or if you want to watch them on your mobile phone, you can just download the app. Okay, that is why I told you to download the app. So for example, if you want to know what were the questions that were asked for surgery in May AIMS 2020, this is a video for you, right? If you want to know about the embryology of the heart, there's this video for you. I had made a video on basal ganglia, right? You can access my Unacademy profile. I had made a video for arteries of upper limb. You can access this video also directly from there, from the app, right? And once you do that, so you will need my profile for that. So my profile is unacademy.com @ Chetanya Mittal, that's my name. D5-4586. I know it's a little complicated. If you just search my name, you'll still get this there, right? There are not many Chetanyas teaching on Unacademy. So besides that, the benefit of downloading the Unacademy Learning app is that you have the option there to attempt these free mock tests. You have the option to attempt free of cost. These mock tests are absolutely free of cost. And you can see that if you have a plus subscription, these log mock tests, you will never fall short of any kind of questions. So you can attempt all these weekly mock tests as well on the Unacademy Learning app. And there's a comprehensive syllabus coverage. This part A is pre-clinical, part B is paraclinical, and part C is clinical subjects. Besides that, you can see for clinical, you have a higher number of courses because next examination, there is a higher weightage for the clinical pattern. So accordingly, these courses have been made in a very structured way. Besides that, you also have batch courses, right? You have 4 courses now. There might be multiple. This is an old screenshot, right? And you have some courses which are there for your syllabus coverage, for your strategy, for your practice, right? All of that is covered. And this YouTube class is another free class for you. So for you to learn, right? So now why Unacademy or why online learning is the best way to learn for NEET PG? The reason for that is we are MBBS students. We're very busy people as far as our schedules are concerned. So we need a flexible schedule for anything. We need to have flexibility in our schedules. We need to learn at our own time, at our own place, and at our own pace. All right. So you can see here that on Unacademy, you will have a class running at almost every time, right? Because there are multiple educators. You can watch at your own convenience according to your own schedule. You can watch a lecture recorded. You can watch it unlimited times, right? Then you can be watching in the language of your choice. मैं अभी इंग्लिश में बात कर रहा था, अब मैं हिंदी में भी बात कर सकता हूँ, ठीक है? When we are in a live class, if somebody asks me to repeat something in Hindi, I do that, right? And Malayalam maybe, Tamil maybe, you can basically be learning in any language, and that gets more relevant when you are doing when you're learning something that is from the non-medical portion from the UPSC side, right? And unlimited practice kar sakte ho yaar. You can attempt the quizzes again and again. You can rewatch the recorded sessions. You can also download the PDFs for everything, right? We'll also get all these PDFs on my Telegram channel. That is @NEET PG Chetanya. That's my Telegram channel. You can also join the discussion group where you can ask any of your doubts or you can talk about a subscription. All you have to do is go ahead and download the Unacademy Learning app, and that will feel like you're right in the classroom. You can see that there's a very good chat feature here in the Unacademy app, which I also use in live classes on YouTube, where you can directly chat with the educator. And when we do MCQ classes, I have interactive polls to ask you what is the answer. I would have included questions here had there been a possibility of a live class for this particular lecture, but this lecture is in a recorded way. You can put all your doubts on the Telegram channel for this, and you have the convenience of learning wherever you want, whenever you want, right? So you can be sitting in a metro basically, and you can still be learning. So now there are 2 subscriptions that I want to talk to you about. Very important. Just listen to this part at least. There's a plus course and there is an iconic course. Unacademy Plus basically includes everything that is there on the Unacademy platform, right? You will get all the live classes, access to all live classes and all batch courses, along with the tests and quizzes. Besides that, there is a structured schedule which will be specially made for you, right? And according to that, all the courses are running, for which you will have complete syllabus coverage. You can simply select plus if you want to take the plus subscription. But I will tell you to go a little one step ahead and take the Unacademy Iconic subscription, where you're not getting just Unacademy, you're also getting Prep Ladder. Unacademy is India's largest online learning platform, no doubt. For medical education, what was going so far was Prep Ladder was the leading app, which was acquired by Unacademy. So now Unacademy is giving you both Unacademy and Prep Ladder together. And what you get here is you get everything that is there on Unacademy. And believe me, in 1 year, Unacademy will have lots of great content, right? And right now, Prep Ladder already has teachers like GRG sir for pharmacology. For ortho, you have Apurv Mehra sir, and these are very famous faculty. If you ask anyone for ortho, they'll say, go ahead, take Prep Ladder. For pharma, if you ask anyone, they'll say, go ahead, take Prep Ladder. Similarly, for medicine, for everything, Prep Ladder is a very decent thing for your concepts and subjects. Is to the point, it is concise, right? Unlike some of the other applications. And with Prep Ladder, you get all the video lectures, right? You get all the question banks, the latest question banks, naya question bank aaya hai, along with the rapid revision course. And you also get the notes. Otherwise, these notes are separately for rupees 6,500. If you otherwise try to purchase these notes, they will cost you another 6,500. But here you get these notes included. Okay, so you just go ahead, select the Iconic subscription according to me, and this is the pricing for Iconic, right? So this is the 1 year plan for 55,000. This is the 2 year plan for 77,000. For 3 year plan, it is for 92,000, right? The moment you apply my referral code, that is Chetanya 10. So I'll just tell you there is only one referral code that you have to use on any course on Unacademy. If you are taking a NEET PG subscription, if your brother is taking a UPSC subscription, or if your sister is taking an IIT subscription or a NEET UG subscription, ठीक है, या रेलवे के लिए प्रिपेयर कर रहा है, कोई कैट के लिए प्रिपेयर कर रहा है, उनको बताना एक ही रेफरल कोड यूज करना है, चैतन्य 10. सो इस रेफरल कोड से व्हाट हैपेंस, you get a straight 10% off. You get a straight 10% off. So you can see that it is already reflecting the discounted price to you, right? So this 92,000, the 9,200 got subtracted and this became 82,800. All right. Now, besides that, if you can use credit, so just proceed to pay here. And when you do that, I will show you here. There's an option to apply credits. There's an option to apply credits. And if you contact me, I'll tell you exactly how to do that. And if you maximize your advantage, you can get a 10% off using credits as well. Just click apply. And if you use my referral code, the best advantage of using my referral code is you will also get a cashback from my end, right? And this cashback from my end, you can claim by texting me on Instagram at the rate chetanya.blue. That is my Instagram ID. And you can also get to me on my discussion channel on Telegram, that is at the rate NEET PG Chetanya, right? Just contact me beforehand before taking a subscription. Make sure you're a new user. Make sure you're a new user. You have a new account, right? And all you have to do is enter the referral code, apply the credits. You will also get the additional cashback. So basically what happens is this course that costs you for 82,800, if you apply credits, right, there's a further discount of 8,000. And if with my cashback, this course will come down to 75,000 or 70,000 for you. All right. And that is really, really cheap, as you can already make out. I'll just show you the calculations. 75,000 for 3 years, and you also get 2 apps, right? So that is basically 12.5 thousand per year per app. Now, what can be cheaper than this? If you compare it to offline NEET UG coachings, which you might have taken previously, okay, that would have costed you somewhere around 1.5 lakhs per year, है ना? या फिर 1.25 lakh per year if you had some scholarship. This is almost 10 times less. This is 10 times less, and you are getting the best of both worlds. All right. So I would say go ahead, take the Iconic subscription. If you are satisfied with Unacademy, you don't want to go ahead with Prep Ladder, just take the Unacademy Plus subscription. Does not matter. And then here you will get the different pricing. For 3 years, this will cost you 50,000, right? So that was an extra around 40,000 for Prep Ladder. So Unacademy Plus is a little more expensive than Prep Ladder otherwise, because there's a difference in the content, there's a difference in the number of educators that is there, right? So there's that. And then here the referral code is Chetanya 10. Same referral code works everywhere, and you'll get a 10% off the credits and the cashback. Everything still stands, right? You know how to reach me. On Telegram, just you'll go and you'll join the channel, you'll subscribe the channel, and there's an option to join the discussion group. Just come there and you can find me and text me. All right. Otherwise, Instagram works as well. So apply कर दिया, referral code apply हो जाएगा, discount मिल जाएगा, credits लग जाएंगे. Yeah, so this was a comparison of the pricing. I just wanted to show you that this for 3 years after discount is 45,000. After discount, this is around 80,800, which will come down to 70,000 if you are able to use your credits well. Yeah, and I will give you some part of it through a cashback via Paytm or Google. Right. So let's start with today's lecture. So there are a few things that are different about today's lecture. One of the things is that Today I have taken a fresh bath, right? So probably cleaner than any of the other lectures. But the point that we should come to now is regarding the lungs, right? So we are now here covering something related to the thorax. And today's lecture is very important. Why? Because how is today's lecture different? Because this topic is more important than most others that we've covered, right? So this is a very, very important topic. Second, we are going to be covering more content than we've been covering in all of these recorded videos. We're going to, this lecture is going to cover a lot of your content, right? So it is going to be a very intensive lecture. And the third thing about today's lecture is that in most of the lectures, you might have seen that there are some notes or there is some text that I have. Today is a pure visualization, a pure image based lecture, right? So a good visualization skill is what you need for today's lecture. And since all of these structures are a little difficult to visualize, a lot of my focus will be on to helping you visualize, to help you remember what are the various structures and how are they oriented in the mediastinal surface between the lungs, right? So we are not doing one topic, we are essentially doing two topics, right? And they are two related, they're a little related, so we're doing them together. So when you start studying about the lung, when you study about the lung, so first of all, my name is Chetanya Mittal. Like I already told you, I am a third semester MBBS student at All India Institute of Medical Sciences, that is AIMS New Delhi, right? So we are doing two topics. One is regarding the root of the lung. Second is regarding the mediastinal surfaces of the lung, right? So today I have just 5 diagrams, and in those 5 diagrams, I will summarize this entire lecture for you, right? So again, we will keep it very crisp and we will keep it very concise so that it is the most efficient usage of your time, right? So first of all, obviously, what are the 4 diagrams? Left lung, right lung, right? The root of left lung, root of right lung, mediastinal surface of left lung, mediastinal surface of the right lung. And there is one diagram that I have for showing you both the roots of the lung together. All right. So that's just a general orientation of what today's lecture is going to be. And very important, both of these two topics, and they're very high probability questions for even if you're appearing for your prof examinations, for those also, and if you are preparing for your competitive examination, then for that too, from the next point of view, that is also an important topic. So first, diagram number 1, right? Diagram number. So just look here. Now, first of all, you need to understand that what is the root of the lung or what is the hilum of the lung, right? The hilum of the lung is basically referring to all these structures that either enter or exit from the lung, right? That is the region that is known as the hilum of the lung. And it has this folding of the visceral pleura which extends downwards and form this ligament, because it's basically a folding of the pleura, so it's called as the pulmonary ligament, right? It is known as the pulmonary ligament, and it has no major function. It's only that sometimes when the pulmonary veins, they have to have an increased blood flow, they expand, and pulmonary ligament allows them some space to expand. So when you include the pulmonary ligament along with the root of the lung, right? So essentially I can write it in this way. I want to write it. It's not a very perfect thing, but the hilum of the lung is equal to. So wait, essentially, if you include the root of the lung is basically the hilum, that is the structure that enter and exit, and along with that you will also have to have the pulmonary ligament. So all these structures, they will form the root of the lung, right? They're present in the root of the lung or the hilum of the lung. Commonly, you will see that these terms are used interchangeably, right? So let's move on to what are the various structures. So you can see here, you can make out here that in red, because they carry oxygenated blood, you've been shown pulmonary veins, right? I hope you get the orientation of this diagram. The lungs have been shown to you in their anatomical position, and the mediastinal structures and all the surrounding structures have been removed. So you can see that this would have probably been the trachea bifurcating into two, right? And as you know, the right bronchus, it is shorter and it is more broad, right? So right bronchus, it is shorter and it divides sooner, right? Whereas the left bronchus, it is longer. Left bronchus, it is longer. Besides that, what you need to know is regarding these are the pulmonary arteries, right? And below them you have the pulmonary veins. So this is a general orientation as to what the structures are that are entering, what is the pulmonary ligament, what is the hilum, what is the root of the lung. Okay. So now we will move to the root of the right lung, then we will see the root of the left lung, right? And then that will be our coverage of the root of the lung. So when you see the root of the right lung, right? This is the root of the right lung, root of the right lung. So this is your diagram number. The first structure that you have to talk about here is the pulmonary artery, right? This is the pulmonary artery. So remember the arrangement of structures in the root of the lung. So you have to know about the contents, the arrangement, and the relations of the root of the lung. Content, arrangement, and the relations. There are three things that you have to know about the root of the lung. So we'll talk only about the major contents. There are a few minor contents also, but we will not go into the details of all of those contents, right? Let's come back here. Diagram number 2. So this is the pulmonary artery you've been shown. So that is one content here of the root of the lung. The second content that you should be aware of, I will take let's say the blue color for the vein. So these are the two pulmonary veins. This is the inferior pulmonary vein and this is the superior pulmonary vein, right? So this is the superior pulmonary vein. This is the inferior pulmonary vein, right? So you can look at their position. I will just give you an orientation of the diagram also, the pulmonary artery. Now, as you know, like I just told you, that the bronchi of the right lung, right? So this is the right lung. So you know the bronchus, the primary bronchus is shorter. So when it reaches the root of the right lung, it has already divided into two bronchi, the eparterial and the hyparterial bronchus, right? It has already divided into these two bronchi. Whereas when you look at the root of the left lung, because the primary bronchus of the left lung is longer, so at the root of the lung, you will see only one bronchus, right? You will see only one primary bronchus. But here you will be able to see the bifurcated primary bronchi of the right side, right? So you will see two separate openings. You will see two separate openings. So there is one that is above the artery. So that is known as the eparterial bronchus and one below that is the hypoarterial bronchus, right? So there is an eparterial bronchus and there is a hypoarterial bronchus, right? So hypoarterial bronchus means below and above the artery. So right, so that is about the contents, that is about the main content. So what are the main contents? The bronchus, the artery, and the vein. Besides that, you will have pulmonary plexus, right? You will have certain lymphatics. You will have the anterior and posterior pulmonary plexus. You will have the lymphatics, and you will have the bronchial vessels, right? The bronchial artery and the bronchial vein. But I'm not going into the detail of that. But I'm not going into the details of that. We'll talk a little bit about the bronchial artery after we're done with both the roots of the lungs. But for now, that is what you need to know about the root of the right lung contents and its contents. Is there anything else that you need to know about the contents of the root of the right lung? That's it, right? So if I move ahead, I'll talk about their arrangement. Now, I told you first you should know about the contents, then you should know about the arrangement. Now, in the arrangement, what is important is that the most important question is which is the superior most structure in the root of the lung. The answer will be eparterial bronchus, right? You can make out it is the most superior structure, right? It is the most superior structure. And what is the orientation of this diagram? Like I told you, this is the anterior, this is the posterior, this is the superior, this is the inferior, right? So it's the section that you are looking from the mediastinal side. So that is the orientation of this diagram. So posterior most, you will have the bronchi. So from posterior, let's green side. All right. Let's write it. Okay. So this is from posterior to anterior. From posterior to anterior, what is the arrangement here? Arrangement is bronchus, bronchi, artery, vein. So generally, what is the arrangement when you talk about any structure? It is NAV, nerve, artery, vein, right? So instead of nerve, artery, vein, you have bronchus, artery, vein. Remember that. Bronchi, artery, and vein. When you talk about posterior to anterior, right? And in bronchi, you have two bronchi, eparterial and hypoarterial. In pulmonary vein, you have superior and inferior pulmonary vein. So which is the posterior most structure? It is the bronchi. Which is the structure present in the middle? It is the artery, right? And which is the structure that is present most anteriorly and also most inferiorly? That is the inferior pulmonary vein. Besides that, you can see that this folding of the visceral pleura, this is the pulmonary ligament that has been labeled. Pulmonary ligament has been labeled for you, right? So the bronchi artery vein arrangement is something that you have to keep in your mind. You have to remember that the superior most structure is the eparterial bronchus. In the middle, you have the pulmonary artery, you have the anterior, and when you come anteriorly and inferiorly, you will have the pulmonary veins, and if the pulmonary veins expand, the pulmonary ligament helps in that, right? So that is about the arrangement of the structures. That is about the arrangement of these structures inside the root of the lung. Okay. So what we have done the contents, we have done the arrangement. Now we move on to the relations. So as you know, the right lung, you have read the statement that coursing over the root of the right lung, right? It arches over the root of the right lung. What am I talking about? I'm talking about the esophagus vein. Right? So you have a vein that arches over the root of the right lung, and it drains here into the large vessel here, that is the superior vena cava. So esophagus vein is the vein that is related superior to the root of the right lung, right? So when you talk about the relations, what is important to remember is that superior to the root of the right lung, you have the esophagus vein. You have the esophagus vein coursing into the superior vena cava. On the left lung, you have the arch of aorta, superior to it, right? Inferior to it for both, you have the pulmonary ligament, inferior to the root of the lung, right? Which is part of the hilum. So you will have the pulmonary ligament, which will be present inferiorly. Anteriorly, what is present anteriorly? You will have the cardiac impression. You will have the phrenic nerve passing, right? And posteriorly, you will have the vagus nerve passing, and along with that, you will have the esophagus, right? So we'll just write this down for clarity. Relations of root of right lung. What I told you anteriorly, what you have to remember is the right phrenic nerve. Besides that, there are some pericardiophonic vessels and everything. Let's not go into the details of those. Posteriorly, what you have to remember is the right vagus nerve. So remember, the hilum separates the phrenic nerve and the vagus nerve. The nerve that passes anterior to the root of the lung, that is the phrenic nerve. The nerve that passes posterior to the root of the lung, that is the vagus nerve. So the right phrenic nerve and the right vagus nerve, that's regarding the anterior and posterior relations. Posteriorly, you will also have the esophagus. Then inferiorly, I told you it is a common relation for the right and the left lung. You will have the pulmonary ligament. And for the right lung, superiorly, you will have the esophagus vein. Superiorly, you will have the esophagus vein. That is about the relation. So now we are familiar with the contents, we are familiar with the arrangement, and we are familiar with the relations of the root of the right lung. That's it for the root of the right lung. Right? So now there's something that I had told you that I'll mention. Let's just go into the details of that for a second, and then we'll come back. I told you about the bronchial arteries. So there are, first thing that you need to know is how many bronchial arteries are there. How many bronchial arteries are there? It's different on the right side and it's different on the left side. On the left side, you have two bronchial arteries. You have the superior and inferior, right? Left superior and left inferior bronchial arteries. So on the left side, you have two bronchial arteries. On the right side, you have a single bronchial artery, right? Both of these, now you have to know where do they arise from. It mostly arises from the right posterior third intercostal. Alright, usually it arises from the right posterior third intercostal. Whereas on the left side, both of these, on the left side you have the aorta present, right? So both of these are direct branches of the thoracic aorta. Direct branches of the thoracic aorta. The two left bronchial arteries are direct branches of the thoracic aorta. The aorta is present on the left side, so they come directly from the aorta. Whereas on the right side, you do not have the aorta, so they are not direct branches of the aorta, but they are a branch of a branch of the aorta. And what is that branch of the aorta? Usually the right posterior third intercostal artery, or sometimes they may arise from the left superior bronchial artery. Sometimes they may arise from the left superior bronchial artery. Right, this left superior bronchial artery. Sometimes they may arise from the left superior bronchial artery. So that is about the left and the right bronchial artery, the differences. Please remember, there is one right bronchial artery, there are two left bronchial arteries. Usually arises from the right posterior third intercostal artery, and they will be direct branches from the thoracic aorta. We've covered the root of the right lung, the contents, the relations, the arrangement. We've covered the bronchial arteries. Now let's move on to the left hilum. So like I told you already, what is the hilum? Hilum is root. Okay. Like I told you, hilum is the root of the lung. Okay. I might have written it in an incorrect way previously. So its hilum is equal to root plus pulmonary ligament, right? If you look here, what are the structures that are related here to the root of the left lung? First of all, you should know that here the arrangement is the same when you talk about from posterior to anterior. Okay, posterior to anterior. Here the contents are also the same, but there's a difference in the arrangement of the structures, right? The contents are the same. You have the nerve, you have the bronchus, you have the artery, you have the vein, you have the lymphatics, you have the pulmonary ligament, you have the various pulmonary plexuses, the anterior and the posterior pulmonary plexuses that are present here, right? So that is what you will have, the bronchial vessels also. I've already talked about the left bronchial artery. So those are the structures that will be part of the contents of the left hilum. Now, when you talk about the structures that are there for the posterior to anterior, what is the arrangement of these structures? So the arrangement remains the same. The arrangement was the same as before. I told you nerve artery vein की जगह यहाँ पे bronchus artery vein है. So the most posterior structure is the bronchus. Then you have the artery, that is the pulmonary artery, and then you have the vein. You have the bronchus, the artery, and the vein. So what is the difference here? The first difference is that here you have directly the left primary bronchus. Right, the left primary bronchus is longer than the right. So here it has not bifurcated. So what you see on the root of the right lung is the single bronchus. What you see is a single bronchus, and that is the left primary bronchus. It has not bifurcated. So that is present here. You can see here is the left primary. Here the difference is there is no eparterial bronchus. So what is the superior most structure here? The superior most structure here, since there is a single bronchus here, the superior most structure isn't the eparterial bronchus. The superior most structure is the pulmonary artery. Although it is present in the middle when you talk about posterior to anterior, but it is the superior most structure. It is the superior most structure. And what do you find anteriorly and a little inferiorly also? You will have the pulmonary. You will have the pulmonary veins. You have the pulmonary artery. You have the pulmonary veins, and you have the yeah, besides that, the superior inferior pulmonary veins दो ही होंगे है ना यहाँ पे again. So that is about the arrangement of the structures here. Now what about the relations here? Let's talk a little bit about the relations here. Yeah. You can look here, there's a very prominent groove. This is the descending thoracic aorta. This is the arch of aorta and some part of the ascending. Here it gives a few branches, the left subclavian artery and the left innominate vein का impression है यहाँ पे. तो basically यहाँ पे दो arteries इधर देती है ये common carotid and left subclavian artery. तो दोनों के impression हो गए यहाँ, right? So basically, what is the structure that is present superior to the root of the lung? That structure is the arch of aorta. What did you have in case of the right lung? So here you had the right lung, you will have the superior relation will be the azygous vein. For the left lung, the superior relation is the arch of the aorta. That's something that you have to remember separately. Besides that, everything is mostly the same. So if I write the relations of the root of the left lung, I will write anteriorly, posteriorly, similar things. Anteriorly, you will have the left phrenic nerve. I told you anterior to the root of the lung, phrenic nerve. Posteriorly, you will have the vagus nerve. So left vagus nerve comes here. And besides the vagus nerve, what else do you have? You have the esophagus. Then if you talk about the superior relation, that is different here. Like I told you, the arch of aorta related here, and inferior relation will be same as the right lung, that is the pulmonary. That is about the relations of the root of the left lung. I hope you can draw the diagram. I hope you can write the contents. I hope you can write the arrangement, and I hope you can write the relations. So that is the entire answer that will be asked for you for the roots of the left and the right lung. So if I just summarize the entire thing, what do you write? If a question comes, write a note on the root of the lungs, right? What do? You split it into two. You write about the left root of the lung. You write about the right the lung, where you write about the, you do four things. You write about the contents. The contents you can write together for both. They're common. Then you write about the relations. There's one relation that is separate, right? And then you also write about the arrangement of the structures. Okay, arrangement you will write before the relations. And then you will do one thing, that is you draw the diagrams for both the roots. Besides that, if you want to do something, you can describe the bronchial arteries, right? Describe the bronchial artery. Now, if I move on to the right lung, you can see, how do you make out that this is the right lung? You can see that there are two bronchi shown in the hypoarterial bronchus, pulmonary artery, and superior and inferior pulmonary veins. So this much is the root of the lung, right? So this much is done. Now we are doing the mediastinal impressions of the root. So this was basically diagram number 1. This was diagram number 2. This was diagram number 3 for the left lung. And now we've moved on to diagram number 4. That is the mediastinal impressions, the mediastinal surface relations of the right lung. Okay, let's talk about this a little deep. So to do this, what I want you to do is to try and draw a diagram on your own. To draw a diagram on your own. So right. So what were we saying? Uh, right. So you drew the right lung like this, right? You will draw the root of the lung. That's kind of the root of the. Okay. Itna draw kar liya. That's very simple to draw. Now think about what can be the possible relations that you know about. Try to fill the space. Try to fill the space here. So first thing that you have to draw is posteriorly. You know what passes. Yeah. So there's a vertebral part and there's a mediastinal part. We're talking about the mediastinal. So most posteriorly, you remember that there is a common structure that will pass. That is the esophagus. That is the esophagus that passes from behind. Right. My diagram isn't very well drawn. Right. That is how you draw the esophagus first. It's the most posterior structure that you will draw, and as you know, it is a mediastinal central structure. So it is a common impression of the right and the left side. It is a common impression on the right and the left side because it is a central thing. Esophagus will have an impression on the right lung also. It will have an impression on the left lung also. Alright. So esophagus you can draw, and after that, in front of the esophagus, you know you have the trachea. You have the trachea present. So just draw the esophagus and the right. That much is easy. Now, as you know here, what is the structure that was arching over the root of the right lung? That structure was the azygous vein, right? That was the azygous vein. So you draw the azygous vein. Now, as you know, the azygous vein, it drains into the superior vena cava. It drains into the superior vena cava. So you will draw the superior vena cava. The azygous vein draining into the superior vena cava. And the superior vena cava, it is made up of the right and the left brachiocephalic vein. So we are obviously talking about the right side. You will have the right brachiocephalic vein. The left brachiocephalic vein will be coming from the opposite side. It will be coming from the left side. So it will not have an impression on the root of the right lung. It will not have an impression on the mediastinal surface of the right lung. So you have drawn the right brachiocephalic vein. You've drawn the superior vena cava. Now you've drawn the superior vena cava. There also must be present the inferior vena cava. There also must be present the inferior vena cava. Okay, there is also present the inferior vena cava, and both of these, they will drain into the which structure? They will drain into the right atrium. This is the cardiac impression. This is called as the cardiac impression, where it is mainly for the right atrium and right auricle. And there is a very small impression of the right ventricle also. Alright, so mainly for the right atrium. That's what you write here. Now, what is left? What is left? We talked about the particular nerves, right? There was a nerve that was passing anterior to the root of the lung, and there was a nerve that was passing posteriorly. So anteriorly, the nerve that was passing like this, kind of going like this, that was the right phrenic nerve. That was the right phrenic nerve, and there was a nerve that was going posteriorly here, posterior to the root of the lung. That was the right vagus nerve. That was the right vagus nerve. Not drawing it completely, but that is the right vagus nerve, right? And now you can probably make out that so what was happening when you talked about the neck. You've done the neck. So the vagus nerve, it was present in the carotid sheath. So it was more anterior, and the right phrenic nerve, it was present behind the prevertebral fascia, right? It was present behind the prevertebral fascia. So it was posteriorly, and the vagus nerve was present anteriorly. But that's not true in the thorax. In the thorax, the relations are reversed. In the thorax, the relations are reversed. As you know, the vagus, it goes through the esophageal opening, right? The vagus, it goes through the esophageal opening. So since it goes through the esophageal opening, since it passes through the esophageal opening, it goes through the posterior mediastinum, which is present posteriorly. And the right phrenic nerve, you know, it is related to the fibrous pericardium. So that is in the middle mediastinum. So that is part of the anterior mediastinum, obviously. And then it passes along with the inferior vena cava. The right phrenic nerve, it passes along with the inferior vena cava. I hope you remember this, the vena caval opening, right? So I hope you can relate that now. The inferior vena cava and the right phrenic nerve, they're passing together here, right below the lung. So that is the in front of the root of the right lung, you have the phrenic nerve. Behind that, you will have the vagus nerve. So those are the main structures that are related to the root of the right lung, that are related to the mediastinal surface of the right lung. You can just have a look here. You will be able to make out the exact same structures that I've just explained to you. Here's the esophagus, here's the trachea, the azygous vein. These are the structures of the bronchus. These are the structures of the root of the lung. Then I told you about the esophagus. Pulmonary ligament is done. Vena cava is done. Then this was the phrenic nerve passing, right? Then it goes through the vena caval opening through the diaphragm. The impression for the right atrium, mainly right atrium and right auricle. Then this was part of the root of the lung. Then I showed to you the vena cava. Then some part of the ascending aorta has an impression here, alright, but not really discussed that. And then the vagus nerve, it was passing here, going through the esophagus, going posteriorly, and going posterior to the root of the right lung. Then you have the right brachiocephalic vein, which joins with the left brachiocephalic vein from this side and forms the superior vena cava, right? So we have covered this entire diagram: esophagus, trachea, right vagus, right phrenic nerve, superior vena cava, which is having a tributary, the azygous vein, which is having another tributary, and here there's another tributary, the right brachiocephalic vein. Another nerve going in front of the hilum, that is the right phrenic nerve, passing through along with the inferior vena cava through the vena cava. That is about diagram number 4, mediastinal relations of the right lung. I hope you have been able to visualize this exceptionally well, right? And you will be able to explain this. You will be able to draw the diagram also for this particular answer. Now let's move to question number 5. Let's move to question number mediastinal relations of the left lung. Mediastinal relations of the left lung. Slightly more complicated than the right lung. Slightly more complicated than the right lung. Now we'll just try to understand this in the same diagram. We'll just do it in the same diagram. The pulmonary artery, the left principal bronchus, the inferior pulmonary vein, they're all part of the root of the lung. This is all part of the lung. Right? Am I correct? So let's safely ignore these. Let's safely ignore the root of the lung. We've done the root of the lung separately. So let's not consider it when we are doing the mediastinal relations. So now we talked about the root of the lung. We talked about a particular relation, and that was this is the descending aorta first, right? Let's start from here. This was the ascending aorta. This is the ascending aorta, kind of not shown. Then you have the arch of the aorta. This was the arch of the aorta, and then below you have the descending aorta, right? So that was the superior relation of the right root of the left root of the lung. So this is the arch of the aorta. This impression here, that must be the cardiac impression for the mainly for the left ventricle, but it is also for the left atrium, left auricle, and the right ventricle. Okay, इन सब का भी impression होता है यहाँ पे, mainly the left ventricle and the left ventricle, right? So that much is clear. First thing, what is the orientation of the aorta and the heart here, right? Now again we will do the same thing. We will draw the esophagus posteriorly. We will draw the trachea. Esophagus and trachea is done. Very easy. Common relation has to be on both sides. Esophagus, trachea is done. Your descending aorta is done. Arch of aorta is done, right? Now what you have to understand is that there's one lymphatic structure that is known as the thoracic duct, which moves from the right to the left side at the level of the T4, T5, right? That we studied in the video for the sternal angle, right? So this is the thoracic duct. You can see that. You have to just also remember that thoracic duct is also relation here. Now when you forget about the thoracic duct, now what is left? Here there was a structure, remember, that was the vagus. There was a structure here that was the vagus. I'll draw it separately. Is this here? Let me blacken the structures that we've covered. Vagus is done, thoracic duct, the lymphatic duct is done. So in front of the esophagus, you could draw the trachea. So the trachea is done. So when you draw the arch of aorta, or I told you that there are two other branches of the arch of aorta which are seen. The left common carotid artery in front, and then you have the left subclavian artery which will go laterally, right? The left common carotid artery will go in the neck, and the left subclavian artery will go towards the upper limb. So again, let's cross off these two branches of the arch of the aorta, and its two branches here. Now what is left is two nerves. I told you, one nerve that passes in front of the root of the lung. So left ventricle is also done, esophagus is done, more or less. We've done most of the things. Let's talk here about this relation. It's a very important relation. So in front of the root of the lung, you know that there is a nerve passing, and that nerve is the phrenic nerve. So this side you will have the left phrenic nerve. In front of the root of the lung, you have the phrenic nerve. Behind which nerve you should have had? You will have had the vagus nerve. Behind you would have had the vagus nerve, not shown to you, left vagus nerve. And as you know, the vagus, it gives a recurrent branch which curves here, which curves upward somewhere here, right? Now that recurrent branch is known as the left recurrent laryngeal nerve, right? That recurrent branch is known as the left recurrent laryngeal nerve. Just have a look at this again. You have the phrenic nerve passing anteriorly, right? Posteriorly, you should have had the vagus, and the vagus, it will give a branch that goes upward. It goes upward like this, goes above the ligamentum arteriosus. If you remember, it goes above the ligamentum arteriosus, right? So, should I draw the ligamentum arteriosus here? Although this is not a very correct diagram because I can't draw this in 3D, but this is the ligamentum arteriosus, right? And you can see here the nerve that is curving above it, the nerve that is curving above it, that is the left recurrent laryngeal nerve. That is the left, on the left side, the left recurrent laryngeal nerve, it curves over the ligamentum arteriosus. And besides that, what you will have. So what does the ligamentum arteriosus do? Ligamentum arteriosus was initially the ductus arteriosus, which was a connection between the arch of aorta and the pulmonary trunk. Arch of aorta and the pulmonary trunk. So below the arch of the aorta, here you will also have the pulmonary trunk. Right? So now you can relate all of these structures together. The recurrent laryngeal nerve, the arch of aorta, and the pulmonary trunk. Right? So now it's very easy for you to remember all the relations, all the mediastinal relations of the left lung. So again, I hope you have been able to visualize this. Diagram number 5, mediastinal relations of the. Very important to know all of this. Esophagus, thoracic duct done, pulmonary artery done, right? Left principal bronchus inferior pulmonary vein, part of the root of the lung, right? Ascending aorta done. Esophagus, I've told you, done. Left ventricle, cardiac impression done. Left phrenic nerve, this is the cardiac notch, right? And this is the lingula. Left phrenic nerve passing in front of the hilum. Inferior pulmonary vein, part of the root of the lung, right? And then the pulmonary trunk, the arch of the aorta, connected together by the ligamentum arteriosus, and arching over it the left recurrent laryngeal nerve coming from the left vagus nerve. And besides that, you have the trachea in front of the esophagus. Besides that, you have the two branches of the arch of the aorta, left subclavian artery and left common carotid artery. It's about the mediastinal. I hope you can draw a diagram. I hope you can write down all the structures, right? The question that can come here is, what are the mediastinal relations of the left lung? Or in the form of an MCQ, it can be asked which of the following is not related to the mediastinal surface of the left lung, and maybe it will write they will write superior vena cava, or maybe they will write esophagus vein. You have to choose the answer. So let's quickly summarize today's lecture, what we did, so that there is absolute clarity. So first of all, I told you about the hilum of the lung. This was diagram number 1. Diagram number 2, we talked about the contents, the relations, and the arrangement of the hilum or the root of the right lung. Then we talked about the root of the left lung, right? And then I told you about the mediastinal relations of the right lung, and then I told you about the mediastinal relations of the left lung. So through 5 diagrams, we have covered some very important stuff. Through these 5 diagrams, you should be able to draw the last 4 of them, the second, third, fourth, fifth diagram. The first diagram was mainly nothing. So the main, let's just move this. So this was the main diagram, diagram number 1, that you should be able to draw. 4 diagrams were the main diagrams. Diagram number 2, you should be able to draw. Then you should be able to draw diagram number 3, and you should be able to enlist all the structures. And then this was another main thing. We have covered 4 very main topics. Some very long answers from your anatomy part, and very important for your NEET PG perspective also. It's a very important part of the thorax per se. And I hope you liked this video. I hope you were able to visualize. I hope you were able to develop orientation of all of these structures. If you liked the video, do hit the like button, right? And drop a comment in the comment section for this video. And also hit the subscribe button for the YouTube channel Let's Crack NEET PG. This is the YouTube channel for Unacademy, their NEET PG division. And you all know my referral code. Referral code is Chetanya10. Use this referral code, get a 10% off. You get a 10% off, and besides that, you also can apply credits. I will also give you a cashback from my end. For that, you can contact me on Instagram. My Instagram handle is @Chetanya, and my Telegram channel is @NEETPG. You can join the Telegram channel. You can also join the discussion group. There you can ask me any doubts about the subscription, or since this is a recorded session, I hope if there were any doubts, I can clear them for you. And I hope the festive season is going well for you. Hit the bell icon for notifications so that you know which educator is live when, and you can take maximum advantages of all these free lectures. So these are kind of very important pearls, anatomy pearls, that are there for your entire learning, and a very good initiative on part of Unacademy that all of this is coming to you free. And if you are liking this content, I will seriously recommend to you, do take the iconic subscription. And like I already told you, an amazing discount on that. Just contact me at all the. Thank you so much for watching. Do drop a comment in the comment section. That would mean